Hi, my name is Sydney Train and I'm the Focus Childcare Network Coordinator here at the Early Learning Division of the Department of Education. On August 14th, we issued new guidance for the operating of childcare and other early education programs during COVID times. We're doing a series of videos to help you understand and implement the new guidance. Please start by watching the introduction video from the Early Learning Division Director, Miriam Calderon. The introduction describes the purposes of the guidance and the process used to develop it. Next, watch the overview. The overview describes who the guidance applies to and the process you need to follow to legally operate. For example, we continue to operate under Emergency Childcare or ECC system, requiring licensed childcare providers and others to apply to be approved to operate as an emergency childcare. This video covers record keeping. This is section 3 of the new guidance, and you will find it on page 21. The focus of this section is keeping records to support contact tracing in the event of COVID case related to the childcare. It also meets the requirements of the underlying licensing rules on record keeping for kids in care. Some of this information will overlap with other sections like drop-off and pickup and daily health checks, so be sure to watch those videos as well for details. Here is an overview of the section. You must keep daily logs of children and adults who enter the childcare and the people who drop off kids or pick them up. You should separate the records by stable group, indicating who is in that stable group and anyone else that comes in contact with them. Indicating the stable group will support contact tracing if that becomes necessary. This can help to reduce the impact to kids, families, and to you, the provider. If there's an exposure, you will want to know this information to limit how many people need to be quarantined. Registered family and certified family providers need to record who visits the home, but only during program hours. Here's the information you need to capture: the child's name, the names of adults completing drop-off and pickup, names of any staff or other person coming in contact with that stable group, arrival and departure date and times for all people. Note the health check results on all children, staff, and any person coming into the program. Record only that the check was pass or fail, not specific information. See the daily health check requirements for detailed guidance on this. If transportation is provided by the program, document names of all riders and their contact information if not recorded elsewhere. Daily logs must be retained for 2 years for all children. If a program is part of a K-12 school, this information can be recorded and incorporated into the school's records for contact tracing. Wear a face covering and, if required, a smock or other covering, as noted in the drop-off and pickup section of the guidance. In addition, see the section on face coverings and smocks and our video, Personal Protective Equipment for Children and Adults, for more details. If people are signing themselves or their children in, sanitize or switch out the pen between use by different people. When one person uses a pen, they're potentially leaving virus on it. In fact, the guidance recommends that staff complete the sign-in rather than parents. However, this is your choice. We expect you may already have questions, and we're trying to anticipate those and provide answers. Does the person dropping off or picking up need to sign the daily log? No. There are no rules in this guidance nor underlying childcare rules or the USDA food program that require a signature. Do I need to have a separate login sheets for each stable group? No. You could have separate login sheets, or you could have one sheet where you mark which stable group the person is part of or comes in contact with. Again, the point is that if public health needs to do contact tracing, they and you will need to know which people have had contact with each other on which day. If you have questions, please email them to providercontact@state.or.us. Again, that's providercontact@state.or.us. Check the FAQ section on our website for continually updated questions and our answers. You may also be wondering what resources or supports ELD will be providing for this section. We'll be updating the daily attendance log on our website. You don't have to use it, but it will contain spots for all the information you need to collect. If you have other ideas for resources, please email them to the address on your screen and we will consider them. Thanks for watching, and thank you for providing nurturing care and education to children, a crucial resource for Oregon's working families.